Good morning, good afternoon, or good evening from wherever you're watching us. My name is Mackrine Abuka, counseling psychologist. I'm a volunteer counselor with Parklands Baptist Church. Today, I'm going to speak about depression in our mental health awareness series. So, what is depression? Depression is an illness, first of all, and I'd like to define it technically. It is a mood disorder, and it causes persistent sadness and loss of interest in things that one was previously interested in. What are some of the key risk factors that would make one experience depression? One is social isolation, and this could be due to illness, like we are having with COVID. So we are finding that those who have tested positive have to go into isolation, and they have limited physical interaction with their loved ones. And that could cause one to be at risk for depression. It could also be a case of a diagnosed illness, a chronic illness or a severe condition like a heart disease, asthma, and diabetes. Yeah. Not having a good sleep pattern is also a risk factor. So one needs to watch out for how they manage their sleep. Genetics is a factor. So if you have a relative who has experienced depression, you are at risk of similarly experiencing it. Conflict is a contributing factor to depression. So you want to check the quality of the relationships. This is between spouses, between children and their parents, children and the teachers, children and their colleagues at school, individuals and their colleagues in the workplace. So you want to check the quality of the relationships. If there's any abuse, that could be a risk factor, and this could be physical, where there's hitting, pushing, and that kind of thing. Sexual abuse is a risk factor. Verbal abuse, using insulting words, demeaning words, those are things that could put one at risk of being depressed, and even neglect. Yeah. Then we have life events that could come across, like the birth of a child is something that could put one at risk of developing depression. The death of a loved one, the loss of a job, divorce, separation, and things like that. So one needs to check in that regard. And what about for children? Because it isn't as obvious for children as it is for adults. So one of the things that is common is that they will also have, issues of trauma. So if they experience abuse, then they're at risk of suffering depression. If they are observing or experiencing their parents undergoing separation and divorce, and of particular mention is an acrimonious separation. If there is some sense of civilness in the separation, the effect is usually not as much. Family dysfunction, where there's a lot of push and pull, that is something that will affect the children. If a child has learning disabilities, that is something to look out for, because if they're not helped to manage their learning situation appropriately, then they stand the risk of developing depression. When a child changes school or you relocate, that is something to look out for. Often parents may not think that it's a big deal, but the disconnection from their social network is something that could affect them and lead them to be depressed. Bullying in school is a very, very significant contributing factor to depression. So you want to check with your child. If they are being bullied, you need to watch for signs of this and intervene in a timely manner. And then, because we know that in adolescence, the boys and girls develop interest in the individuals of the opposite gender, at that point, there's also breakups that happen. So when they experience breakups and rejection, that is something that could put them at risk of developing depression. So you want to find an opportunity to make it possible for them to share those experiences. So, having understood those risk factors for children and adults, what then should we look out for so that we can intervene for depression? So there's 4 categories that I'll speak to, the first of which is physical symptoms. So you'll find that someone who's experiencing depression is likely to have a reduced threshold in terms of tolerance for pain. So very small things that would otherwise not be a big deal, when they experience them, they feel like it's very, very magnified. They'd have aches and pains that are not related to any form of infection. If they are subjected to, testing in the hospital setup, they will find none, but their pain is real. It will be headache, stomachache, backache, but no infection to be found. For some, they could even have stomach upset. They'd have a running stomach, but when you run the test, nothing. All because they're having depressive experiences. Muscle aches is a common symptom with depression. For some, even their vision is affected. So you find that they struggle to see where sight was not a problem. And when they go to the optician, there is nothing that is found to be a problem with their vision. And a very key one is general fatigue. They are tired, not as a result of doing anything, they are just tired. Too tired to even lift their heads up. Now, that is something to be concerned about. In terms of behavior, if one is having depression or is likely to be diagnosed with depression, then you'll find that they will tend to withdraw from friends and family. They will tend to isolate. They'd want to keep to their room and not leave. Their sleep pattern will be distorted. Either they'll be sleeping way too much or, sleeping too little. In terms of getting things done, they will struggle to get things done. So you find that you keep repeating to them. They're like, okay, I'm going to do it, but they end up not doing it, which is problematic. You will find that a person who is dealing with depression is highly likely to self-medicate. So what is self-medication in this instance? It is taking substances to try and help to calm the internal turmoil that they are going through. So you'll find them using alcohol, you'll find them using prescription medication, you'll find them using other forms of, drugs like cocaine and heroin and bangi, also that they can calm the internal distress that they're feeling. Some even go into gambling because it sort of helps to create a sense of excitement where otherwise they are feeling very low. They would cease to engage in activities that they previously enjoyed. So if there are people who used to run, for example, they would not do that anymore. If there were people who used to play football, they'd have no interest. If they're playing instruments, no interest, and one then wonders why all of a sudden you're not interested, and yet you are very, very active there before. It could be a function of depression. So we want to get that assessed. So I just like us to appreciate that with depression, what you'll see are changes in what is otherwise considered normal behavior. How about the feelings? Feelings also are affected when one has depression. So there's a deep sense of guilt of things that have happened. And at this point, I'd like to just stress the fact that with depression, broadly speaking, the concerns are usually about things that have already happened in the past. So one is processing those things and finding that they're not really able to make proper meaning of them, and their life is affected. The normal daily living is affected. And contrasting that to anxiety, which is worries about things that are yet to happen in the future. So with a depressive person, you'll find that they have a deep sense of guilt of the things that are bothering them, even where they really had nothing to do with it happening. And it is normal to be guilty, but the level of guilt that someone who's depressed has is elevated. They have sadness that seems not to go away. Some of the people who have experienced depression call it a cloud of darkness. They just cannot seem to get out of that sad space. And it is sadness that persists for days on end. Yeah? So if someone is sharing that they're feeling sad and it is something that is persisting in combination with the other symptoms, you really want to get them to be assisted. They may be experiencing frustration at levels that are unprecedented. Yeah? So you want to get that checked. Irritability is like everything just irritates them. Nothing seems to go right. So that's something to look out for. In terms of confidence levels, as one gets deeper into a depressive state, they tend to have a decline in their levels of confidence. So where you knew someone to be a very confident person and you see them progressively declining, you want to have that checked. And then indecision is also another thing that is manifest when one gets into a depressive state. Now, the thinking is also affected. So a person who is experiencing depression is likely to be having thoughts that lean towards negativity. So what are some of the things that they'd be saying to themselves as they have those not very helpful thoughts? Some of the things they'd say is that, oh, I'm a failure. No wonder I just can't get these things done. Nothing good seems to happen to me. Whatever happened was my fault, even where really it wasn't their issue to be too concerned about. Life isn't worth living. Life would be better off for others without me being present. I am worthless. I'm not worth taking, the trouble to do anything about. So those are some of the thoughts that you'd find someone who has depression dealing with. Now, how about children? What are some of the symptoms that you'll see with children? Sadness is one of those, a very deep sense of sadness. They would withdraw from the social activities that they have been used to. They'd not be playing with their friends. You'd find that they have reduced interest in going to school. Performance would take a nosedive. It just starts going south and you can't quite put a finger on it. They'd be very irritable. And they really just don't take care of their grooming. So you find that you keep having to remind them, please go and take a bath, change your clothes. They wouldn't care less. So when you start seeing such kind of symptoms, you want to be concerned. So if one then is having signs of depression, what ought we do? Some of the things that we recommend for those who are that way affected is encourage them, if they're adults, to go and seek professional help from a qualified mental health service provider, because it is an illness and it is treatable and it needs to be diagnosed. We should not be the ones to diagnose them. We just say we are seeing symptoms that lend themselves to being possible depression. So encourage them to seek professional help. It helps that they embrace a spiritual kind of engagement. When you go into a church setup like Parklands Baptist, for example, you get to meet with other believers. You find yourself engaging in activities that give you more meaning and increase your motivation. So that is something that would be encouraged. Developing and nurturing strong social networks is a very, very important thing in helping to manage depression where it has been diagnosed and to prevent it where it has not surfaced and perhaps there's risk of it surfacing. So you want to look at the quality of the friendships that you have. This is within the family setup, within the school setup, within the other social activities that one engages in. And really apply yourself to make sure that those relationships are healthy. It's not just those casual things of, hey, hi, how are you? And nothing else. Seek to avail yourself to be present, in those relationships, because then they come in handy when one needs support. Exercise is a very important part of helping someone to manage depression. It keeps you distracted from the negative thoughts. It energizes you. It increases the chemicals that, are found to be deficient when one has depression. So it's for one to choose what is your favorite exercise. It could be dance, it could be soccer, it could be volleyball, swimming, whatever. But just get yourself moving, get yourself involved, get yourself interacting with other people. The interaction is a key factor. Parenting is also another area that needs to be looked into, because like we said, when there's dysfunction in the family, the children will be affected. So as a parent, you want to lend yourself to what is considered to be positive parenting. Look at how you're disciplining your child. Look at how you're giving direction to your children. Look at how you're involving them in decisions that affect them. Don't be the person who makes decisions and gives it to them to implement, and not being willing to listen to any feedback that they may have. Be a good role model. Don't be the kind of parent who says, do as I say, don't mind what I'm doing. That doesn't work with children. Children are more inclined to do what they're seeing than what they're hearing. So you want to engage in very, very good role modeling. So with all these things taken into consideration, it then would be that if somebody is affected with depression, they can get help. And what we are trying to achieve with these talks is to encourage people to appreciate that the mental illnesses or disorders that they may find themselves facing are part of normal day-to-day living, just in the same way as you would have malaria, and they are treatable. So one shouldn't feel shy to come up and say, you know, I'm feeling this and I feel I need help. So with that, I say thank you.